Those new guidelines issued just this month call for physicians to limit inductions to certain patients. Labor is induced in 1 in 5 American births, and C-sections account for a third of all U.S. deliveries. Those rates have more than doubled in the last decade. But there's also a growing demand for nurse midwives, as some women opt for births with less intervention. Tonight, we take a look at the effect midwives can have on health care and costs.
A certified nurse midwife is an individual who is trained in both disciplines of nursing and midwifery.
Dr. Susan Stone is president and dean of the Frontier School of Midwifery and Family Nursing based in Hyden, Kentucky.
We're proud to have the largest school of nurse midwifery in the country here.
Demand for nurse midwives has continued to grow, and Dr. Stone says that's because more women are looking for more control of the birthing process.
Nurse midwives have a lower cesarean section rate than obstetricians. And also we have several studies that show when a nurse midwife is involved in the prenatal care, there's less infant mortality, less neonatal morbidity, and that probably has mostly to do with the time that nurse midwives spend teaching women to take care of themselves.
Here comes the placenta, you see.
About 97% of certified nurse midwives still deliver babies in the hospital, but women can have a different kind of birth and see a difference in their bill.
Nurse midwives generally practice evidence-based care, and that means that they won't order an ultrasound unless there's a reason. They won't order unnecessary lab tests. Things are not done by routine. Things are done by indication, and that cost to the healthcare system entirely could be huge.
The cost of additional interventions during births is either passed on to insurance companies or patients. And Dr. Stone says nurse midwives offer options more women and the healthcare system as a whole should consider.
We cannot continue to treat every woman as if she has a high-risk pregnancy because it costs too much for our healthcare system.
On a personal note, there was a certified nurse midwife and obstetrician at the birth of my twins. I valued the experience and skills each offered. Certified nurse midwives also perform annual exams and reproductive health care visits. For more information on nurse midwives or the Frontier School, visit the health section of WTVQ.com.